Muskoka Algonquin Healthcare has announced a major deficit they are expecting. CEO Natalie Bubella says the government's change to the healthcare system funding model has made it more difficult to balance their budget.
I'm sure the community is well aware that we've had many years of deficit funding, and what I mean by deficit funding is that we've not received any increases, and as a result of that, some of our inflationary costs, like our staff working through their grids on the salary grid, the cost of pharmaceuticals and other supplies have gone up, but we've not received any increases in our funding. So that's created a real issue for us, and for this year, we know that we have a budgeted $2.6 million deficit in the organization. We have been able to balance over the last 5 years, but this year will be a challenge for us.
Because of this challenge, Bubella says an analysis has been done to determine where they can find some savings.
Given the fact that we've had that deficit funding situation and things are getting tighter and tighter on an annual basis, is we look specifically at what areas in the hospital seem to be out of whack or not consistent. And we found that our emergency department and our surgical services area were not receiving the amount of dollars from the Ministry of Health through the new health funding reform approach that's been implemented about 3 years ago as our actual costs. So we're operating at a higher level than we're funded for, and our operating costs are also different from what one would expect in those two areas and what our peers are doing as well. So as a result of that, we brought in the Hay Group, and we asked the Hay Group to specifically look at those two areas where we had the cost pressures.
Although this report makes several recommendations, Bubella says some of them may not be realistic for our community.
Some of the areas that they pointed to as potential opportunities for us is to look at our staffing models. So for instance, in the emergency department, there was a suggestion that we could go down a certain amount of FTEs in that department. And that is something that we're actually exploring to see what the feasibility of that is. I think there were areas that the Hay report maybe didn't take into consideration when they looked at that particular example, such as we have large volumes of patients that come through our emergency department, particularly in the summertime. And this fiscal year, we actually had that surge in volumes continue right up till Christmas. We also have numerous transfers that occur, so they may not have been aware of that particular nuance for us here when they brought forward that recommendation to reduce our staffing complement in the emerge.
Other recommendations include reducing the amount of diagnostic testing and reviewing practices in the operating room. Bubella says the report outlines a potential $1.4 million in savings. However, no decisions have been made yet. Administrators have been directed to work with staff and doctors to investigate the report further. The report is available on mahc.ca.